Go around and start 4 o'clock.
Good to see you too.
All right. Hi, everyone. I know I want to be respectful of your time, so we'll get right at it. And today is a big one. There's a lot of content today, but I'm going to try my best to make health and safety as sexy as possible for us and program operations the same. When we think about this, we never know what's going to happen. I think COVID has showed us that, what we're seeing in the Ukraine right now and how that might impact programs. All of this is right at the forefront of what we're doing. So though these kind of back-end admin operations can seem like a hassle to deal with, having a sense of kind of what's going on in the back end is really important. So we're going to get through a lot so that you have a chance to sort of understand how operations for study abroad work, what you might think through as you're working on this. And hopefully there'll be time to think out some case studies as well. So I'm going to go through just quickly the whole Tulane, just a review of the Tulane approval process. Though we're going to focus on kind of pre-departure moving forward, but just so that you have in your head what are some of the mandatory controls that we have through Tulane. On your table, you have examples of the risk and liability documentations that all students sign when they're engaged in summer programs. So that'll be helpful just for you to review and see what you have now. And go through some checklists of pre-departure stuff that would be helpful for you, and think through the emergency response protocols. So a lot of sexy information. We're going to get right into it. 30 seconds just to get our heads spinning about this. Brainstorm, for those of you that have done this before, what are some of the crises, major or minor, that you've had to handle when leading a summer abroad program? And if you're new, what are the things that you feel least ready to handle? So we'll take just 30 seconds, if you can, with the person beside you and brainstorm that.
And that's not bad answer, and that was just totally emergency kind of stuff. They don't have a 911, I think it's like 211, they have a number of, yeah, 212 or something like that, so they'll give us a number. And I'm pretty sure GIS, like, hopefully we'll give us some cards around us, what happens, I guess, all the regular. Okay, GIS is call them right away, but everybody, if it's really bad, then you call hospital. It's right there. So I think that they're always still, given the emergency we had a great the first thing they did was get
Okay, thank you. I know this isn't enough time, but we're going to keep this to an hour. So could you throw out to me some of the things that you all talked about? What came up? Stolen passports. Emergency hospital visits. Jail. Yep. Yeah. So when thinking about health and safety, we threw out these major things. All of those things have happened. Dealing with students that go through sexual assault abroad, that have broken a limb and have to have surgery abroad, appendix removals abroad. All kinds of crises that you all name as sort of these big ones. Losing all your documents, not just your passport, but every single ID that you have, and how do you deal with that? So today we're going to be going through some of those and sort of what would you do in those scenarios. And then we're also going to talk about just the fact that most of the health and safety that you're dealing with will be these things that we don't necessarily assume as huge crises, but are very important to the well-being of our students. So how they're navigating culture shock, how they're thinking through, getting their prescription meds abroad, these kind of little things. So we'll keep those two things in mind. So the approval process for Tulane abroad, just as a reminder, The cycle of a program is an intensive process of review, and especially now with COVID. And so any new program, and I think most people in here have been operating are on programs that have been operating for a while now. But just as a heads up to you, any new program being approved at Tulane goes through a very extensive review process. And it's an extensive health and safety review. And some of our older programs, you'll know that we've been touching base with you to kind of get them up to speed with where they have to be. So now that happened in the proposing and the development of program process. You guys are at the pre-departure planning, and all your programs are running stage. So that's where we're going to focus today. But just have in mind that if you're working with our office or another managing office that is coming back to you needing more kind of approvals or needing more liabilities, this is because there's kind of a heightened level of review for any sort of operations to happen right now. So the way the sort of Tulane operations for international are happening, I'm your point person when you're dealing with undergraduate study abroad exchange and programs that are credit bearing. There is also, for those of you and I think none of them here are in the room today, but they were invited, that are dealing with graduate students that are dealing with research abroad and that are dealing with non-credit bearing experiences abroad. Your first point person is Wade Wooten, and then they will get routed to me for certain approvals. So just having that in mind, if you're in your department or you have a colleague that is working on graduate research or non-credit bearing programs, that there's an approval process. If you're giving out any sort of funding for an international, you cannot do that without going through approval processes. Just have that in mind. So what are some of these mandatory controls that we see now? So first, the Tulane's international travel ban still exists. There is a ban on all international travel at this point. This could change any day. There is a process that is currently happening where the ban may be lifted, but at this time it still exists. And study abroad has an exception to this, but we still have to go through the petition process, which means that all students, all faculty have to be petitioned before students and faculty are able to travel. So if you're on an OSA operated program, we are doing this petition process for you. It's a lengthy process. It does take some time. It means we have to have students all confirmed at the right time. It means we need to have all faculty confirmed at the right time. So as you're feeling that stress of, the early deadlines for things, it's because there's more steps involved in getting this stuff off the ground. To review, academic approval. So anytime that there's a shift, a course shift on your program, those things, there's curriculum committals that have to happen. There's chair approvals that have to happen for that to go through. In this stage, we're all good with the people I see here, but just if I know that there's some Stone Center and CPS programs happening, that if there are any course shifts or a new special topics course happening, make sure that they're getting dean and chair approval prior. ITG vetting. So right now everyone is pretty much going through this petition vetting process. If we get to the point where the travel ban is lifted, the travel warnings are still going to be in place. So if your country is at a 3 or above, you'll still need to go through a vetting process. So we'll wait and see what that guidance looks like, but just having that in mind for yourself. And then the ways at which today that we track through Tulane. So one, all students and faculty will have to be registered through Concur. I'm going to talk more about this in a second, but this is going to be a headache. We all know this. The rollout's gonna be complicated, but we're going to figure it out. And all will be enrolled in Global Rescue. The other thing that must happen for all undergraduate credit-bearing group activity is that they must be properly registered in our system, which is called Teradata. And that will include certain waivers and things like that. So a student that is not committed in Teradata has not gone through the proper waivers of liability in order to be part of a Tulane program. And I say that because if you're keeping track of students that say, oh, I think I want to apply late or things like that, make sure if you're a faculty member that you're coordinating very closely with the office that is coordinating your approval of students in the system, because if they haven't done those, they are not approved to travel. They do not get yet the petition to travel. So you may have different numbers for how many people are traveling if you're trying to keep that on your own. All students must have health insurance. There's a way to report international incidents, which we're going to go over. So if you have a situation where you take a student has to go to the hospital, a report is filed. If you have a situation where a student goes to jail, a report is filed. So we're going to go through how you report, the crisis plan, and sort of how we manage things in Teradata. All right, I'm going to keep going, but in a second I'll pause because I know this is a ton of information to tell you. So the first thing about booking travel, you're going to start getting questions for students about booking travel. So as I mentioned, if you're on an OSA program, we're going to do this petition for you on your behalf. So your group will get notification from OSA that it's okay, you can now book travel. If for some reason you cannot wait to book your travel prior to OSA's doing this petition process, and we hope to start it next week, then you'll need to navigate the Tulane travel ban independently. And so I've put the website up here where you would navigate the travel ban if you're booking on your own, and keep that in mind too if you have research travel coming up. At this moment, you need to go through this travel ban. Yeah.
And I'll just indicate that on Concur, there is a link to this. So when you go to book your ticket on Concur, there's a link, and Layla Foss is approving those pretty much same day. So it does go really fast.
Yeah. And so when you do it, so you can either, once you've been approved, so you've done that you tried to go book on Concur, it said, no, you can't book, you need approval. So then you do the approval form. Once you're granted approval, you can book, you'll be able to book directly through Concur, or you can use Tulane's travel service, which is called World Travel Services. And then you'll also, through OSA programs, be automatically enrolled in Global Rescue, which is your emergency response.
Can I ask a question
yes.
on that last one? If we go through the Tulane booking, is that using like one of your T&E cards, or are we still using our own T&E cards for that?
Yeah, great. So for in general, all travel should be on T&E cards. So if you are a faculty member traveling and you do not have a T&E card, please let your office know, and so we'll figure out what makes sense for that. If you have a T&E card, you will probably need to have your credit limit increased, and your credit limit has to be increased by the issuing department. So for example, if you have it through science and engineering, it would have to be the person that manages science and engineering that would do it.
What kind of number? Because I did check on that, and they told me what my cap was. What kind of cap are you guys looking at?
I think it was going to vary depending on how much stuff on your program that you think about booking. So for example, in your case, many of the large chunks of things are booked by DIS. So you're really thinking about, okay, how much would I need for student meals, for my own meals, to book my flight? So I would say between 5,000 and 10,000.
Really, and it's a per month cost, isn't it?
It's per month,
Okay,
and so
less than 5.
yeah, and so what's going to happen is that person will likely need Casey Love to sign off saying that we're the department that is it's going to be charged. So your first contact, say, okay, figure out who's issuing your card, say, contact Casey Love and say, I need an increase of X amount on my card, and she can help you and communicate that, yes, I can confirm that OSA will be paying the expenses incurred during that time period. Yeah.
If I want to do a batch, like travel ban petition, do I use the same form, or is there another?
You can email. We can talk after, but to how to batch it. But pretty much, we're going to work directly with Lainey Armstrong, and hopefully not even be able to sidestep that. So, Megan, and we can we can touch base.
So back to this one, if we click on that link and go, is that taking us to the Concur booking on that link right there?
No, so one way to get through it is to go to Concur Booking and just try to book Stockholm, and it's not going to let you, and it's going to pop up this form. This is a Qualtrics form that is asking for for an exception to the travel ban.
I see,
So-
okay.
So this would
So
happen.
we're not going through OSA for booking, we can book our own, even the group together might do it, and then we just do with the teeny card at that point.
Exactly. Yeah. Yes.
This may not be the moment, and I'm fine if you want to answer this later, but what are we doing with students who say, I cannot book through Concur?
That is a great question, and it is in the provost's office right now as something that we want taken care of. So students traveling on miles, students that say, I'm traveling all these different places first and then going, how do I handle that? And it seems, I've gotten word that there will be some sort of a liability waiver that students will be able to sign, saying that they understand that they should book through Concur and they are releasing Tulane of liability. And they should know that if if there is a crisis, if because of the conflict with Ukraine, they're asked to come home because it becomes unstable in Europe, as an example, they would be responsible for the rebooking. If we're doing it, we would help them through that whole rebooking process. Yeah. Any other questions on that?
With the rebooking process on the coming home, are we assuming then complete liability, like if the airline cost goes up dramatically, since students pay for airline portion?
Yeah, so when World Travel is booking, they are consciously booking on flights that can be can be altered to a certain degree. So what happens is if they change, say all of a sudden the program can't go and we cancel that, it becomes travel credit that the student can then use. And so, for example, like when we had to evacuate all students from study abroad, if they're booked through Concur, we can call right away and get them rebooked on another flight. And so we're not dealing with the issue where we had students on hold with Delta for 6-7 hours trying to get rebooked. We have a direct line to book and help on that student's behalf. Yeah. So, navigating the travel plan for OSA programs, the 15th, and we have a few programs that are on to the 17th are the dates that we're hoping to have final lists. We have some straggling students that we're trying to get their final info from. So next week we're going to be going through this. So you should be hearing from us sometime next week about the petitions and if students are eligible to book. For some of you, it might make sense to wait on booking so for my group in Senegal, I'm going to wait until our first pre-departure to explain this to students and explain booking, but you will ultimately have students that, especially on some of these programs where they're booking travel alone, that will want to book ahead of time. So tell them to wait for the petition. Once they get the petition, they're able to do this. Yes?
Sorry, it's a booking question
Yeah.
again. So gas prices are going up astronomically and airline prices are expected to go up, and the longer we wait, the higher those costs are. And I was already looking at Dublin, and $1,700 is pretty basic, and that doesn't include the ability to change tickets. Are we having anything that's going to help address that possibility?
We can review budget. So if we get to a place where we see that, oh my gosh, the cost is, we need to increase the budget for travel for faculty, we want to do that. So for the next coming years, we have that in there. We have the budget, so we know the wiggle room that we have, and we'll just, obviously if the ticket price is more, the ticket price is more. So we just want to make sure we have that in our updated budget. So as we're estimating what the cost and number of students are, we have that for future.
Okay, we have that for the future. But I was also thinking, like with students, the longer we tell students to wait to book, the possibility that those airline tickets go up.
Totally, and then that's why we're going as fast as we can to navigate the process for the petition, and I really hope to have that to you by next week.
Thanks.
Yeah. And the help that we can get from you is the more pressure that you can have for students to commit, because I need the students to be committed in the program before I can do this. So we're the more that, and we're sending daily reminders, the more that you all can send daily reminders, the better. And then I'll also just note, because of this, because we're having to push all of this up earlier, in order to get travel warning approvals, for those of you that are teaching, students have choice selection in courses. It means that if you're on a program that we're trying to find enrollment to see if all faculty can go, this might have to happen before your first pre-departure, or you might want to call your students all together even earlier, so that we can confirm that we actually know how many students are in each course, if you have any courses that are on the limit of not sure, okay? Okay, so what are the responsibilities for you all on site? So the trip lead and the faculty, so you're in charge of, in terms of health and safety, that you understand the sort of the emergency communication plan, that you have a list of all of your travelers and contact information, so if anything happens, you know how to locate the student. So WhatsApp is a great way to sort of have all the students together, making sure that you have their email list, and you also want to know what your kind of protocol is of who you would call in case there's emergency, and we're going to go through that in a second. You want to make sure that you're providing guidance to students about autonomy of travel away from the group. And in general, on all programs operating currently during this travel ban, and moving forward, given the uncertainty with COVID and the uncertainty with the political situation, we are recommending that student travel not be allowed outside of the country, because travel bans can happen at any point. You can enforce that, if they are to violate that, they're in violation of the academic and disciplinary policies of the program. You can enforce that if something were to happen and they weren't able to get back for your course, that's an unexcused absence that would be impacted in their grade, those sort of things. Your trip leader responsibilities is that the students should be supervised on all site visits. So those of you that are working with on-the-ground staff, and you may have on-the-ground staff accompanying faculty leads and faculty support, are required to be on these on-site visits. So we want to have at least 2 people always, and both for health and safety reasons and for these intercultural reasons, to help sort of bring all elements of the course together. No student self-driving, so I'm not going to go into detail, but there is. Everyone should have their health insurance. They have to have health insurance in the US. They also need to have some health insurance coverage abroad, so you should know what that's for your program. The Geo Blue is what we use if the program provider that you're using does not have healthcare coverage. So if you're not sure what yours is or how you and your students have insurance, touch base with OSA, with your lead for OSA. No uninsured activities, no bungee jumping, etc. And there's also a vetting process. So each program should be vetted for disciplinary and academic standing prior to departure. So if you're doing that with this through OSA, we do this for you. And for other programs here, just make sure that you're following those protocols of doing proper vetting for students prior to departure. What kind of support do you have? So in most cases, you're working with in-country partner staff. So know that in that relationship, they're going to provide you with some sort of on-site orientation upon arrival that will really help place you within the context of your host culture. They're going to be your primary point in case of an emergency. So you should know who on the ground would be your first call. They'll also lead cultural activities and be your logistical support throughout, and sort of helping you to kind of place health and safety in a cultural perspective. So what are the things that might cause you to go to jail by drinking too much alcohol in public that you didn't know was a reason why one could be jailed? And then what is the responsibility of Office of Study Abroad or your host office? So we're going to provide you with help and support through this pre-departure stage. And so hopefully some of this material you can pull and use in your pre-departure. Many of you will have in-country support staff. In Italy, I will get with you because you have a large program. So we'll make sure that we can do that. That will be your contact in case of an emergency after your local staff. So you'll have an on-site support if you have it. But then our office back here, if something were to happen, you would contact our office, and then we're going to manage all the finances and the billing, etc. So I know there's some programs, none here, that are operating with a provider in-country support for the first time. If you have any questions about those roles, I'm happy to answer those. Yes?
In the past, we've been given kind of like that tree of emergency, like phone numbers. Are we going to be given that too? Again, like when we need to call back here, like Eric was there and stuff like that, like to have that again?
Yeah, of like the phone call of tree
Yeah.
in the
Like,
US at Tulane.
Hell in a handbasket, we have to call.
Exactly. Yeah, we're going to go over that in a second. What it looks like on Tulane, so that those of you not operating with OSA know it, and those of you operating through OSA will have this information. So a couple of things resources for those of you to review, and for those of you that this is new to. The Forum on Education Abroad, they have standards of good practice for study abroad, and these are what we're required to follow, or what the standards, not required is not the right word, what we push to satisfy for all operations at Tulane. And so it might be helpful for you just kind of to review these standards and think about your programs, and if you're meeting the kind of the basic standards in all of these areas, and especially in health, safety, and security, and policies and practice. And I'll imagine that for many programs that have run for a while, the health and safety and policies and practice, you might not know all the ins and outs, but I think it is important that you start to become aware of sort of those back-end operations. It'll help you on the ground understand what you can do with students. So, liability and student enrollment. We talked about this a little bit. We need to have all students committed in the system. So on your table, you have a printout of the documents that all the students are signing, just so that you're aware of sort of all the liability waivers that they have. And this is the official roster. So again, we have to have them officially in the system. And we need them to sign these release waivers to participate. So the more that you can help us get that word out, it's a tiring job for OSA advisors. This is kind of, and program operators and other programs, it's a kind of a constant follow-up with students. And so anytime that you're engaging with students, get a sense of where they are. You might help them navigate the system online if they need hand-holding. Point them to OSA advisor, have them go there. And so this week we're going to be withdrawing non-committed students. So any students that you're speaking with, make sure that this is known. And for those of you not operating through OSA, these are the two people that you contact for disciplinary and academic records checks for students.
And
Yes?
non-committed students, ones that just haven't done anything once being accepted, or the ones who've done some of it but not all of it?
So if a student has not done anything, they've already been withdrawn. So what we have right now, we're in the stage where we have students that have been accepted. They finished all the documents, but they have not yet paid their deposit, and they've not yet committed. They've not confirmed that they're actually going. So they've filled out the whole application, but they haven't told us, yes, I commit to this program. Yeah.
One of my students wrote to me, I think yesterday, that she was doing all that and had asked for her itinerary. And I said, you're not allowed to have an itinerary yet, so leave it blank or say stay tuned or something.
Exactly, that's the perfect advice. One of the post-decision documents is for them to upload their travel itinerary, and they can't do that yet. So that's the one thing that the post-decision that can continue until we know that. They'll have to, at some point, sign back in and do that, but for now, it's not due. So when you're having your pre-departure, so now we're going to go into some things to cover with pre-departure, or to make sure that you know this with students. So all students are required to have cell phones with an international plan. So this can be a little tricky because, of course, while we are covering this international plan for faculty, we're not necessarily doing this with students, and there's obviously a cost with this. So our goal here is to create the most amount of compliance possible on this. So we want we'll have students that for financial reasons or whatever reasons they want to rely on WhatsApp most of the time, so not using their data most of the time, using WhatsApp when they're contacted through Wi-Fi. At this moment, it's going to be hard to get total compliance, but what I would hope that you would press is that that student does know how they could activate their international plan. So if an emergency did happen, their phone is set up that they could turn on their data and make an emergency call. Or if all of a sudden that on the drop of a hat, we have to do an evacuation, that we're able to get in touch with them. So if you have students that are just using WhatsApp most of the time, you really need to impress on them that they need to check regularly on their phone. We just dealt with this. I was in the middle of the Red Beans parade over Mardi Gras when we evacuated students from Russia. So it happens on the drop of the hat, and you have to, we need to make sure that we can get in contact with those students.
I noticed that you don't have SIM cards up there as an alternative.
Burner phone could be SIM cards. So so whether it's their phone so you could also bring an unlocked cell phone and put that in. Great. Okay, what is the emergency response protocol? So you all at the beginning kind of brought out some of these major disasters or major things that might happen: political unrest, a medical emergency, a mental health crisis, where we might need to institute the emergency response plan. So what should we do? So one thing, we want to have your local emergency response plan that is shared with all students on your program. So they should, and we want to make sure that we have the local on-site resources for them 24/7. So this might look like the emergency contact of the trip lead or all trip leads, or all trip participants if you're rotating who has the 24/7 emergency phone. It might look like your on-site staff. So if you're working with a provider like CIEE or DIS, that it would be the local emergency contact of who they would call there. It would be the insurance provider information, so their insurance card, that they know what that looks like. And it would be Global Rescue, that they know how to contact Global Rescue. And then also the U.S. Embassy and the consulate. You should know that as well when dealing with students that have a lost and stolen passport. So first step is sort of, what is your on the ground, what are the first calls, and what are the things that you want your students to have in their pocket at all times in case there's an emergency. And then we get to the point which is the question that Laura brought up, is okay, so what are kind of what's the next round of calls? What do I do? So so if you're dealing with a crisis that is first response, where your student gets hit by a bus and you're there right there, of course, the first response is the 911 equivalent in country, so you need to know that information. From there, you're dealing with your local on-the-ground support. So, the in-country provider number, whoever that person is that can help you navigate. And then, of course, the project leads need to be contacted. And when you arrive at the hospital, the insurance. So each one of these insurance is a little bit different, but in general, the insurance is by reimbursement. So the students are going to need to put money down for the health care, or we can get support from OSA or from the in-country program. So if there's a case where the student does not have the funds, of course, we want the student to be covered. So thinking through what that looks like. So it might be that you're there with your T&E card, putting the money up front. Or it could mean that we're taking a loan from your provider who is gonna cover, and then that student will later be billed. So keeping that in mind. And then these secondary contacts. Let me just see. Okay, yeah. So what happens at Tulane is if you're working with OSA, you have two options. So one, if you call Global Rescue. So you're going to be enrolled in Global Rescue and you call Global Rescue. That's going to automatically start the chain of emergency contacts. So if you're on a program with CPS and your person at Trip Lead calls Global Rescue, it's automatically going to institute the chain of commands from the provost office of who responds to emergencies. So that's one way to do it. Also, if you're working with OSA, contacting OSA directly, so I'm your first point of contact. And then it goes down the line, and we're going to share this with each one. You'll have we have a document printout that will show you of sort of who gets the calls, but I get it, Casey gets it, and then we kind of go down the line of staff that are in office to respond to this, and then we're working with the risk management team at Tulane. So yes.
I'm sorry, I had a question. So all of the students in the program, the Mandela program, I ensure that they have Geo Blue when they're traveling. But is it a requirement that they have their own personal insurance as well? I usually ask for it, but I never said this is mandatory.
Yeah, it's mandatory that they have domestic health insurance on top of that. Yep. Any other questions about that?
I guess, how are we supposed to collect that information, or how do you collect that information?
Through Teradata, so they're asked to upload their information in their application. Okay, any other questions on that? So whoever your managing office is, if you're not sure the protocol or who gets the calls, should you call Tulane, ask to see the document or the response protocols, because each one of our offices should have a sort of a list of who gets the calls. And for OSA, I'll be the first one. If you call the Tulane police and you say, I have an emergency abroad, I'll be the first person that gets that emergency call to my cell phone. So just so you know that, and then we have a list of people that it goes down the list. Okay, medical care abroad. So this also varies culturally, and I think it's an important thing for you guys to cover in pre-departure so students are aware of what to expect and think through it if they were to get sick abroad. And also to think about sort of what it would be like and look like. So while in our context, a student might have a little bit of a sore throat or feel allergies and go see a doctor, that might, they may not necessarily get a prescription for those sort of things in their host country setting. Or two, especially during COVID, it could instigate a whole cycle of things that they're just not prepared to handle. They know that they don't have COVID, but if they're starting to present symptoms, that might mean a particular time of quarantine away from the program. So really trying to assess with students what is their need and thinking critically about, and so obviously if a student is sick, we want to respond to that. But if that is in that cultural context responded to in a medical setting or not, and pretty much, so a couple of things. Global Rescue has a line that students can always call, that 800 line on this app that they're going to download. And if they just have a consultation, like, I have a little bit of an allergy, I want to take a medication, I'm not sure what an allergy medication is, and I might be able to get over the counter in Ireland. They can consult. They can also tell where a local hospital and things like that are. So those are things important. Yes?
So if a student has specific medication that they need to take with them, what kind of documentation do they need to get through customs?
Hold that thought.
Okay.
A lot of these things for medical care abroad, for those of you working with a third party provider, they're going to help you with. So, and you can enter in that conversation when you have your first kind of like touch base of like, what does it, and you're curious, you're about to get travel, and it's like, what is the emergency situation like? How far would the ambulance ride be if we're on camels in the desert? All those things that you want to kind of figure out, you can talk to. But this first emergency response is really our in-country personnel. And so that's why we're really, really stressing that we want strong in-country partners that are able to cover a lot of this health and liability for all programs. Cool. Preparing students. So this is just a little review of the topics that you may cover in your health and safety. So, you know, working with OS staff will also be involved in this when you're doing pre-departure, making sure students understand all the forms that they're signing. Obviously, academics is you thinking about travel details. So if there are particular areas that you're going that might pose certain risks or things that they need to consider. So if they're going to go in a place where they need to be sure to get sunscreen or worry about dehydration, that you're kind of doing that preventative work with them as you go through the itinerary. You're going over conduct policies, etc., kind of in that pre-departure stage. So you're really thinking about your program from a health perspective and a safety perspective, and doing your best to prepare students for that setting. And then as you get into the on-site orientation around health and safety, and this is where you're going to also have the support of the on-the-ground staff, is when you'll really start to, you know, show site maps, show housing and locations, show area no-go areas. Introduce local culture that might have an impact on health and safety. And at the end, I'll share some resources that are just kind of overall websites that students can refer to right now to understand health and safety. Out of order, but this is an example slide that you could use in a pre-departure to tell students about awaiting what they should know about traveling. So you can just cut and paste this into your presentation. I'm going to share these slides with you. Advice to students, and this gets where Carolyn brings up what are the things to help prepare. So they should be consulting with primary health care. So there are certain programs that are going to need more vaccination. So for example, the Sinoval program, everyone needs the yellow fever vaccine. So we need to make sure that students are following those protocols, seeing their primary care physician, and then thinking about their prescriptions that they take. So if they're taking birth control, we want to make sure that they remember to take the amount that they need, or whatever prescriptions that they have, that they're taking the amount they need. There are certain prescriptions that may not be legal or may not be able to travel, where they need some sort of notarized authorization to use those. And so if students have questions about that, they can direct those questions to our office, but you can also get this information by going on to the CDC information and travel information by country to see what if there are any kind of medications that might not be legal in a certain place, or that might need special authorization. So for example, I was dealing with a student that had rheumatoid arthritis, and the medication that student was taking needed special transport, and also needed to be chilled while it was abroad. So thinking about those things logistically and creating the opportunity for students to think about that, because they may not have had to think of that before. And then the other thing that you'll deal with is just thinking about your students' dietary restrictions as you're planning meals, and communicating that with the in-person staff that's booking for students, that if there are particular dietary needs that you have to keep in mind.
Is that something that students are putting into Pcr also?
They don't put their dietary restrictions. So this is a fun cultural moment, because on the Tulane liability side, we're not allowed to collect some of this information, but on your program provider side, they are. So they will be getting this information when they enroll in their third-party provider. Yeah.
Yeah, so I had added the question into our Terracotta application asking for dietary restrictions, and then Wade told me like I couldn't ask that. So how should I, like, what should I do? Because we have to, like, we have to communicate with the partner so that we can accommodate all their needs.
Yeah, it's a very tricky thing. It cannot be official. So you're going to have to, thinking about who, in your case, in Ecuador is what I'm imagining, we have to get your operation in Ecuador operating as a partner, and collecting that stuff.
Like, they have their own form, but I was like, oh my God, this is just all duplicating what the students have already done in Terracotta. Let me just add in these 2 questions, And then,
Yeah.
so.
Unfortunately, navigating legal systems across country, there's just not much we can do. And I think part of that is explaining to students from a cultural perspective why
Okay.
we're having to do this. But and many program students are they're filling out 2 forms. So they're sort of enrolled and accepted to study abroad through Tulane. And then there's a review of document stuff part that happens with their third-party provider, and some of them ask for medical reviews, but we can't ask for that information legally here. Yeah.
So what we've done in the past to get around like point blank question is we've said to students, are there any food requirements or concerns that you would like us to know about? That means that gives that person to say, well, actually gluten or this and that, but we're not sort of saying, tell me your dietary restrictions. We say, is there anything you want us to know about? And I've kind of felt like that's a gray area that seems to be okay so far.
Yeah, I would think that something like that would work. If it's like self-reported in a post-decision document, you might be able to.
Yeah, and I do it like just during orientation. We kind of just put it out there.
Yeah.
Like, we're doing all this other stuff, and it's like, and if there's anything, and we do it along with anything else that you think we should know about.
Exactly, yeah. So I think that's the thing of like, what is officially in the system of sort of like liability things, what we need to put forward and what we can't, and then kind of this gray area of actually how things operate on the ground, which happens during your pre-departure sessions and on-site orientation. So in thinking about like the collection of that, working with Jordan as the trip lead, that what part of his role is collecting that, because your kind of role, administrative role, you may not be able to ask for that info directly.
Okay.
Yeah. Okay. We covered this, health insurance in the U.S., health insurance on in-site. Ask the student the question, do you know, what would you do? How would you use your health insurance card if something were to happen? Make sure they understand, and that's a good way to do it in your pre-departure. So you break your leg abroad, how are you going to pay for it? Do you know if it's reimbursement? Do you know, sort of what the options are? Do they carry their health insurance card? Just so that they're aware of it. Information for reporting an incident. The same thing happens internationally as happens on Tulane. So if it's Tulane concerns to submit a report. So if you have an issue where you have a student with a mental health crisis, if you have a student that gets COVID while abroad, if you have an issue of a student who breaks their leg abroad, if you have a student that violates the disciplinary policy abroad, all this stuff goes through concerns. So, and this is pretty important. On the university level, this is something that they want us to be compliant on. I also tell you this as like just thinking about kind of the management of programs abroad and the number that OSA is dealing with when we're talking about fall, summer, just the amount of work that goes into kind of doing this too. So I understand, I'm so understanding that this is can be a what happens when it goes here. And so, for example, we are mandatory disclosures. So a student comes to you and says that they were sexually assaulted. You are a mandatory reporter of that. So this would be something that would have to go through this form. But it's important, the student might not want people to know. They might feel like they can tell you about it, but they don't want to do anything about it. And so navigating that really student-centered is important, because we don't want this to feel like this is just a form and a bureaucrat. We want to be student-facing. So the way that I would handle something like that is to really explain to the student that you're there to support. Nothing has to happen that they don't want to happen, but that you are a mandatory reporter. And what this will do is it's going to give them access to the information that we have at Tulane to best support them. It's completely their prerogative if they want to follow it or not. So it's going to trigger a case manager who can tell them about services, who can tell them about reporting if they want to report. but they are under no obligation to do that, and that you would work very closely with that student on site to sort of help them navigate that. So this is something that I would say is important to do. The other thing that I've noticed with this is that and students can also use this, so they can report directly. So a student, you could also say, do you want to do this with me? Do you want to put it in your own voice? And they can do this directly. Reports that aren't attached directly to student names are less likely. Whether it can be investigated depends, because if they say, someone on my program sexually assaulted me, so if it was an intergroup thing, nothing can really happen unless actual names are named. So that's just a thing to think about and work with through students. Or I deal some with reports from students that say, my faculty member was racially biased, for example. If they're not naming names, there's no way to really follow up. So those are things that we think about as well. All right, your on-site orientation. We don't want to scare students, right? We don't want them to be completely, thinking that something wrong is going to happen all the time. But we do want them to be aware. So they need to be at sort of this relaxed alert. So there's a balance, because as we cater to, if the more that they're in that group, the more that they feel immune to anything happening. So for example, we get most of the pickpocketing that happens like at opening lunches or dinners, because they're here with this big group. They think they know everyone, so they leave their bag on the back of the chair when they go to the bathroom, and they don't tell the people beside them, and someone takes it. So just like thinking about that, especially in those beginning stages when students are first arriving, that they just need to be sort of prepared and on alert for these things, and be aware of their situation. They're used to operating in New Orleans, and as they know, in the context of New Orleans, there are certain places where they would go and they would not go, or they culturally, from being from the US, they have some sense of understanding what might be a danger or not dangerous scenario, but they might not understand that in the new cultural context of both neighborhoods or just the ways in which someone shows danger. So talking about what does that look like in your host country setting? What are the things they should be aware of? As you plan this on site, think about jet lag for your planning. What can they ingest at that beginning so that it actually works for them? Think about guiding them around, showing them from one place to another, so that they have a sense that they know, if they need to pick up something at the pharmacy, where to go, or if they need water because they need to purchase water, that they know how to get there, that they have a sense of their neighborhood, etc. So these are sort of the protocols to take acceptable transportation routes. So for example, if they're in a place where you shouldn't go on flagged taxis down in the street, make sure that they are aware of that. If Uber is good one place but not the next, just kind of what are the safety that are important there, what are the no-go areas, police stations, etc. Sort of all of this happens on site, and really keeping in mind jet lag and fatigue, and sort of helping them build out their mental map of where they can, what points of safety are. COVID, so the fun one. So we will be collecting all COVID documentation for travelers. All travelers are required to be boosted, just as Tulane, but this is just really important to enforce, because students that do not have their boosters, it could be that they're not, they don't get that green pass, or they're not able to go into restaurants or things like that. So it's really important that all members on your group are boosted. If you have people that had the waiver, they have the Tulane waiver, you need to talk to those students individually and look at the requirements by country. So just because they have a Tulane waiver does not mean that we can necessarily waive the international requirement for what has to be. So there are places where we cannot accept students to travel if they haven't received all 3 boosters. Again, we talked about limiting the travel, and having a sense of the local quarantine policies and relevant information around COVID. And then in your pre-departure, be sure that you're stressing what the PCR testing protocol is. So all students are going to need a PCR test prior to departure. It's going to be 48 to 72 hours as of now, for depending on your location. It's a little bit of a varying, and this is tough logistically because and you might even think about what day you're flying out. So for example, if you're flying out on a Sunday, that means maybe the place is going to be closed on Saturday. So how do you get your results in time to meet that window? So you have to help students think through that logistically. If they're flying in and out of New Orleans, we can Tulane can generate a PCR code for them, and the same for faculty. You all can get your PCR code, your code generated for a PCR test in your window of time. But we need a plan for all students. So if they're not flying through Tulane, through New Orleans, that they're aware of, that they've thought about where they're going to get that test, and they have a backup plan. If a flight gets delayed, for example, and all of a sudden their window passes, then they're not going to be able to get in country. And so in airports, in most cases, there would be a place where they could get a rapid PCR test. There is a price to that. They're $200 to $500, so that students are thinking about that and aware of that. Yeah.
If we were wanting Tulane to issue the QR code, who would we reach out to about that?
The individual should reach out,
Okay.
and it's the same email that you get the QR code from. It's like
Okay.
testing at
They would just
Tulane.
say, like, I'm going on an international
Yes,
trip,
I need a QR code,
Okay.
and they'll give you the date.
Can people bring rapid tests with them?
You can bring rapid tests. I suggest that students bring rapid tests, that they bring things to check their temperature. Now, for travel, rapid tests are not accepted. It has to be a PCR test from a medical institution. So those rapid tests would be just as your monitoring program, or a student feels bad and they want to just test it. Do I have COVID? That they would test. But
So if there was a delay in your flight, okay, and
that rapid test would not count.
okay.
It has to be a PCR test, so it
So
needs.
if you had a PCR test, but your flight was delayed, which meant your test was more than 72 hours.
They have to retest. That doesn't.
At the airport.
Yep. At the airport, or leave the airport and go to the Walgreens or whatever. So if you have a student connecting, I would have them think about that. So if they're connecting through New York, what would happen if your flight got delayed and that meant you were going to miss the connection? Where would you get your PCR test, and what would the cost be, and are you prepared to pay it?
Right.
Yeah.
I would just mention too, we've been collecting the pre-PCR antigen test just to have with us while we're abroad. So we do get that kid that's showing some symptoms and we want to find out, like, is it just a cold or is it something else? We can do it without any additional cost.
Yeah. And so.
I'm just worried about.
Yeah, no, I'm just saying like abroad, just if you want to bring some of the free tests with you.
Yeah, and most OSA programs, your group is going to be tested upon arrival. Like, so this isn't the travel piece, but this is for our program to start. You'll be tested again once you arrive, and you'll be tested prior to departure for you to return. So we're going to help coordinate your PCR test for your flight home. But students have to do that for their flight there. And I was so surprised last year that Italy, everybody made it. I was like, this is going to be a headache. They're not going to figure it out. But we really stressed this, and they did it. And it was also luck because the flight didn't get delayed. But this was my anxiety. This is going to be your anxiety.
So the antigen test coming home, because coming into the United States, you can take an antigen test. That's a student cost, not a program cost.
It varies by program. So on your program, it is, Meredith just left. I forgot.
I'll find it.
I'd have to look at the budget to see if we put it in or not.
I don't know. Okay.
And is there a site to look, whether it is 48 or 72 hours, and then on our other phone, on their Zoom, you actually said it might even be arrival, not departure. So is there a place to look for that information like that?
Yeah, you can go to the CDC or the State Department site for that country, and it'll say, and also look at the particular airline. So you should look at the country requirements, and you should look at the airline requirements.
Yeah.
So there are certain airlines that they might have flights that have, so particular like quarantine-free flights, which means they might have particular requirements so that you skip country requirements and things like that. So look at your local airline and in country.
The embassies for every country, like the US embassy in that country also has really good complete COVID.
Oh, good.
for that country.
Europe is dropping them fast
Yeah.
at the moment.
On-site orientations again. So you're covering COVID protocols. You're covering in this COVID, managing COVID. You're covering with them what would happen if they would need to quarantine. So that means all of your courses have a quarantine plan so that the student may continue virtually as needed. And whether they're quarantined or whether you quarantine. And it also means that they have an awareness of sort of what it would look like for them if they are in quarantine. We talked about transportation. You review the transportation on site. We talked about accident ratios here. And upon return, we are through our program evaluations, we're collecting health and safety effects that you're also kind of using the reflection process at the end to see, are there ways that you could mitigate across program any of the concerns that you may have. Here are some dedicated websites that Beth, that you had mentioned, where you can pull up this information, and we'll share these slides, and you can share these with students as well. And for safety. So that's a lot. We stopped at the hour here. We didn't get to the case studies. There's just so much new risk and travel stuff right now with Tulane. But take a look at the case studies. Think about how, do you know your emergency response in these scenarios? And you can update them or use them or tweak them with students as examples of things to kind of use as health and safety warm-ups with students. And I'm happy to answer any questions. I'll stick around. So thanks for being here. Yeah.